Of course, we know that there are certain toxins that can and will interfere with our ability to move. An acetylcholine agonist would result in more contractions. What if a system was completely flooded with acetylcholine? So much contraction that convulsions might take place. That causes massive contractions and convulsions. Why? Because it's an acetylcholine agonist. What if toxin that we're exposed to is actually an acetylcholine antagonist? What will the end result be? Paralysis. That could ultimately result in death. Your textbook will just give you a couple of examples of acetylcholine agonists and acetylcholine antagonists. You guys know that that list is not exhaustive. There's so many more out there. Myasthenia gravis is an autoimmune disease, and basically what happens, bodies produce antibodies, and those antibodies then bind where acetylcholine should bind. It's also weakness, because the acetylcholine can't bind because some of those antibodies are already taking up the receptor sites. So myasthenia gravis is usually recognized by a couple of telltale signs, and one of them has to do with the drooping eyelids. Beyond that, sometimes a person's speech seems slurred. It has to do with where the antibodies are binding, and they usually bind to areas that impact the face and the head first. So that's why you're going to see paralysis or slowing somewhere around the face. Right? If it's not treated, eventually it starts to cause breathing problems and swallowing problems. The good news is if myasthenia gravis is recognized, there's tests that they can do. They can give medication that tries to counteract those antibodies. So muscular dystrophy is caused by the degeneration of muscles. Dystrophin is a protein. It helps to protect our muscles from injury. In people who have muscular dystrophy, they have an abnormal dystrophin protein. The protein doesn't work like it's supposed to. Fortunately, we don't have good treatment for this. Well, it is almost always detected in childhood. They do have treatments that help to prolong the life, but the outcome is not good. Even worse is what we call Duchenne muscular dystrophy. It is the most severe form of muscular dystrophy, and that there's no dystrophin protein at all. Every time our muscle is injured, it rebuilds itself. However, when this protein can't protect those muscles, or in the case of Duchenne, when there's no protection of the muscles at all, this is what happens. If a baby is born and this baby, unbeknownst to anyone, has Duchenne muscular dystrophy, they have no dystrophin protein. As that baby moves, which those muscles are going to get injured, and then they're going to get back up, and then they're going to get injured and get built back up. We start to see these tiny 12, 18-month-old kids who look like bodybuilders. But over time, when the muscle gets injured, it doesn't have the capacity to build back up anymore. And so when it gets to the point where it can't build back up anymore, then the muscles just start degenerating to the point where death will result. Muscular dystrophy is abnormal dystrophin protein. Duchenne muscular dystrophy, no dystrophin protein. Polio, we know, has been eradicated thanks to vaccines. The virus itself was super contagious. So my point is sometimes a disorder of movement can be caused by a virus. We already talked about spinal cord damage. So waist down versus their cervical area, which is up in the neck. All right, let's talk about ALS, amyotrophic lateral sclerosis, ALS, also known as what? It is caused by a degeneration of motor neurons. Okay, so the alpha motor neurons create a synapse with a muscle fiber. Acetylcholine is released, we have binding, we have muscle contraction. The muscles itself in ALS are unharmed. It's the alpha motor neurons that degenerate. So the muscles deteriorate or experience atrophy because they're not getting any input. They're not getting any information or signal to contract. Paralysis and death, exactly. So the alpha motor neurons degenerate, but they know exactly what's going on, completely intact. There seems to be a very strong genetic component in some cases. Cases where ALS is familial, the SOD1 gene seems to be the culprit. Only 10% of the cases seem to be familial. The rest seems to be caused by something else, and no one seems to know what it is. However, there's a very strong correlation with a history of concussions in developing ALS. Any history of head trauma, like brain injury, outside of concussions. other genes that they have found that are associated with ALS, but they all seem to be new mutations. So it's not always pointing to the same gene. There seems to be lots of genes that seem to underlie ALS. No one really knows is the answer. About Parkinson's disease next. Parkinson's disease is a neurodegenerative disease that is actually caused by degeneration of the substantia nigra. Provides input to the basal ganglia. Has to do with the dopaminergic neurons and dopamine. So if the substantia nigra degenerates, we are not going to have enough dopamine. If the substantia nigra degenerates, the basal ganglia is not going to get the input that it needs. When someone develops Parkinson's disease, some of the more common symptoms are the tremors. Michael J. Fox and Muhammad Ali are probably the two most well-known, seem to know about. But over time, their face doesn't have the ability to show expression anymore, called frozen faces. Anything that has to do with movement starts to become impaired. Speech becomes an issue, problems initiating voluntary movement. So they fall easily, they lose their balance quite often. And if you see someone falling or losing their balance and they're slurring their speech, I can understand why someone might assume that they're inebriated, but you don't want to make those kind of assumptions. Towards the end, the person also experiences dementia, but it's a different kind of dementia. Dementia would be kind of a change in a person's cognitive ability in terms of memory, language, speech, but it's a different kind of dementia than you're used to with Alzheimer's disease. So a lot of the treatments have focused around that. L-DOPA, they have medications that mimic L-DOPA, but they have a way to give them a precursor. And the idea is the precursor will then eventually become synthesized into actual dopamine. That does work for some time. However, it's hard to regulate. What is the result when someone has too much dopamine binding? The problem is because it's so hard to regulate, I might have too much dopamine binding, and now I'm showing symptoms of psychosis. For someone with schizophrenia or some other psychotic disorder, they wouldn't be aware, but the person with Parkinson's is aware. And this is similar to this medication. It does work for a period of time. After a while, though, once the substantia nigra degenerates that much, no amount of L-DOPA is going to be able to generate enough dopamine for proper functioning. Does that make sense to you guys? So it's a temporary treatment. Your textbook is going to discuss some other treatments. There's some really, really good outcomes with stimulating parts of the basal ganglia. Gene therapy looks pretty promising. When we look at Parkinson's, it looks like there's like an early development of Parkinson's, early age and late age. While the outcomes tend to be the same, it looks like there's two different sets of causes. And when we look at the early onset, there seems to be 8 or more genes involved with that. They have not necessarily found specific genes that underlie this late onset Parkinson's. Of course, people want to know, is Parkinson's disease genetic? And the answer is, it depends. If someone's got an early onset, then yes, there's a lot of genes involved. But if someone's got late onset, it does not appear to be genetic. Well, if it's not genetic, why are some people getting Parkinson's late in life? If it's not genetic, got to be something environmental. And they have made associations, these are just correlational studies with certain toxins in the environment. Certain pesticides and things like that we accidentally consume or maybe we live by. Very, very interesting. History of concussions or head trauma greatly increases someone's risk. If someone has a history of concussions or head trauma, they are 11 times more likely to develop Parkinson's disease. If they were 2 times more likely, that would be really significant. I'm saying 11 times more likely. Men are 2 times more likely to develop it than women. Kind of interesting. Drinking caffeinated coffee, not decaf, not frappuccinos, we're talking black coffee, have a 4 to 5 times reduced likelihood of developing Parkinson's. And again, no one really knows why that is. Antioxidants are really, really essential for our brain. All right, Huntington's disease is the last one. The only thing I wanted to say about that, this also impacts a very specific part of the basal ganglia called the caudate nucleus. Huntington's disease there's a gene on chromosome number 5 that is defective, and it causes the degeneration of the caudate nucleus. There's a gene on chromosome number 4 called the Huntington gene, by the way. This disease doesn't usually surface till the mid-30s. And usually the first step in the disease of Huntington's is depression and or anxiety. If you have a parent with Huntington's, then you 50-50 chance of developing the condition. 50-50 chance. It's what we call an autosomal dominant condition. You have the gene, the condition will surface. So usually it starts in your mid-30s. It starts with anxiety and or depression. Okay. Then there tends to be problems with movement, which is why it's in this chapter. So you might have heard of the term Huntington's chorea. It's involuntary movements that happen as the disease progresses. There's memory problems and psychosis, and it's usually from onset to death. Huntington's is fatal. It's usually a 20-year from onset to death. So the person usually is diagnosed in his or her 30s, usually passes away in his or her 50s.